patient today asked about amitriptyline or Elavil, which is an older antidepressant in your tricyclic or TCA category of antidepressants. This is a medication that's used in various medical conditions, and it's used often by neurologists as well for the treatment of fibromyalgia, post-herpetic neuralgia, diabetic neuropathy, and other pain syndromes, and other conditions. It can be a very effective medication for the treatment of depression. So sometimes I'll prescribe this for patients with major depressive disorder when your SSRIs, your SNRIs just aren't fully doing the job. And just because these medications have been out since the 1950s doesn't mean that they're not effective. And so they work by actually inhibiting the reuptake of both serotonin and norepinephrine into the presynaptic neuron, allowing more serotonin and norepinephrine to be present in the synaptic cleft, the space between neurons, to move forward or just to be more available to decrease someone's depression symptoms. These medications aren't as commonly prescribed now because they do have a lot of side effects, and they tend to be less tolerated than your SSRIs or SNRIs. Again, for some individuals, they work really well and they are really well tolerated. Side effects do include a lot of anticholinergic side effects. Anticholinergic side effects include dry mouth, constipation, orthostatic hypotension. So if you stand up too fast, you might feel a little bit dizzy or lightheaded. They can make you feel pretty tired when you take them, so they're usually taken at night. And some patients will say that taking it at night before bed actually helps them to fall asleep more easily or helps to treat their insomnia, which might be a welcome side effect if someone has insomnia as a symptom of their depression. These medications, if you take more than they're prescribed, or if you are sensitive, they can actually cause significant arrhythmias in for someone's heart. So torsades is a side effect that can occur from overdose. QT prolongation of someone's EKG and their heart rhythm can occur with these medications, and that can be really serious and can actually be deadly. If someone takes these medications and they feel confused, that they also need to have immediate medical attention. And then just like with any antidepressant, if someone has suicidal thoughts when taking one of these medications or taking this medication, it's incredibly important they get immediate help from a medical provider, or call 911, I get to an emergency room, I get to a hospital to make sure that they remain safe. But with that being said, untreated depression is going to be your leading cause of suicide. And so if someone is having difficulty with suicidal thoughts or with depression, I believe that they really need to talk to a mental health professional to discuss options, whether it be medication management, psychotherapy, behavioral changes, or other modalities of treatment. If you believe this video pertains to you in any way, please be sure to reach out to a medical or mental health professional directly. These videos are informative only and not meant to be medical advice for anyone.